Well, look, I appreciate the commitment and the dedication on the part of Senator Leno to try to make sure that everybody has health care. There's certainly myself, I'm certainly interested in that as well. However, listening to some of the dialogue here, you know, frankly, if we would put back to work the over 2 million people that are sitting there right now unemployed, you'd have health coverage for them. If we hadn't chased over 700,000 manufacturing jobs out of the state of California, and we chased them out of California, they would have all had health benefits as well. You know, that is really what the problem is, and that is government's problem and government's fault in this case here. We have failed. And so if we failed in all these other areas, why would you want to take on something new? I mean, like we've done it so well with everything else that's in our charge. I just can't afford to take the risk. But what I do know is this: if we focus all our energies on putting the hardworking families of California back to work, they will get health coverage. And that's what we should be focusing on. So I would encourage not going forward with this bill. As Senator Runnert has indicated, we're willing to work to try to come up with something that does help curtail the cost. But keep in mind right now, the small businesses of California already have a heavy regulatory burden on them as it is, and a heavy cost. And if you really want to help them so they can help and make sure their employees have access to health care and things like this, you need to start focusing on that. I'd encourage a no vote. This bill is not ready to move forward. You know, I heard that also that the Senate had a reputation for never sending a bill out that still needed more work. And it seems to me like we might want to get back to those good old days when that's what we did here as senators. Finish the work before we send it over to the Assembly.